Hi, I'm Nancy Blotner. At Caldwell College, we believe that all citizens need to be informed about the important issues that affect their daily lives. That's why we're proud to support the programming produced by the Caucus Educational Corporation and their partners in public television.
The safe disposal of prescription drugs. Next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by United Water. Making the planet sustainable is the best job on Earth. New Jersey Natural Gas, proud to support education in our communities. Barnabas Health. New Jersey Manufacturers Insurance Group. Auto insurance, homeowners insurance, and banking under the principle of stewardship. Wells Fargo. And by the law firm of Gibbons PC. Promotional support provided by NJ Biz, all business, all New Jersey. The Star Ledger and NJ.com, everything Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.
Welcome to Caucus, New Jersey. I'm Steve Adubato. With nearly 4 billion prescriptions filled each year, 1/3 is left unused or expired. The pharmaceutical waste often ends up in our water supply or even in the hands of our youth. Here to teach us about safe disposal, we have David Miller, pharmacist and owner of Miller's Pharmacy in Wyckoff, New Jersey. Our good friend Rich Henning, Senior Vice President, United Water. Captain Bill Sheehan, Executive Director of Hackensack Riverkeeper. And finally, Eric Kanefsky, Director, New Jersey Division of Consumer Affairs. I want to thank all of you for joining us to talk about this incredibly important topic that does not get a lot of media attention. You're going to see a couple of websites throughout this program that frankly are intended to help you know what to do about prescription drugs hanging around your house. You don't know what to do. Those two websites, we're going to start right out of the box. One is, put it up, DisposeMyMeds.org, DisposeMyMeds.org, and tell folks right out of the box what that is. Rich?
We're a partner with the National Community Pharmacists Association, and Dispose My Meds was a program that they came up with simply to use all of their networks of community pharmacists throughout the United States to give people the opportunity to safely dispose of their medications rather than throwing them in the garbage, or worse, throwing them down the toilet and flushing them and putting them into the water stream. So that's simply what it is. It's a fantastic program. It's all for free. Consumers just bring their drugs to their local pharmacist, and it's a safe disposal method that is used. Before we go to the government website from the Department of Consumer Affairs, we're going to talk a little bit about this from a pharmaceutical perspective, from the pharmacy perspective. Rich talks about it, and these guys brought this issue to our attention a couple of years ago when we were talking about this at United Water. Pharmacists are intimately involved in this initiative. Why?
Well, many of us live in the communities that we serve, and I feel very strongly about the ecology of our area and the water supply. I have children in town and have been waiting for an opportunity, and have been waiting for a long time. When the NCPA initiative came around,
NCPA?
National Community Pharmacists Association initiative that sponsors the Dispose My Meds program. I saw it as an opportunity to at least do my part to get some of those medications out of our environment. So we were one of the first pharmacies to jump on that bandwagon, and in fact we were able to do some promotional advertising for United Water when it first happened. And I see on a daily basis anything from a small bag of medications, 2 or 3 bottles of medications, to the worst I've seen so far was 3 garbage bags worth of medications that was brought to my pharmacy for destruction. In this case, it was someone who had received a large order of medications. He was a dialysis patient. He received it on a Monday from a mail order pharmacy. He died on Tuesday, and they didn't know what to do with the medication, so they brought it to me. And I ended up having to destroy that medication, which is a whole other topic. If you'd like me to discuss that, I'd be happy to talk about that.
Well, help us understand this. What, if we were not doing this, if the right thing were not to happen, and we'll talk about how the proper disposal methods should play out. What are most people, too many people, doing right now with unused prescription drugs? What are they doing?
Sadly, they're flushing it down the toilet.
Okay. What's wrong with that?
Well, that's where I come in, because several things happen when you flush medications through the system. Sewage treatment plants are not designed to treat the water to remove those pharmaceuticals. So the pharmaceuticals pass right through the treatment system out into the receiving water. Wherever the wastewater is disposed of, you're getting treated wastewater, but it's still laced with pharmaceuticals. And what's been happening around the country, and there's been several studies done on this in different areas, where enough hormones that are contained in things like birth control, like estrogen and stuff like that, gets into the water, and you have fish that actually change gender.
Whoa, whoa, what do you mean fish change gender?
Entire populations of fish go from being male to male-female on a regular average to being all female.
Because of prescription drugs, because of estrogen?
Yeah, because of prescription drugs being passed into the system through the sewage treatment process.
We are, hold on, we're dumping prescription drugs into the toilet. We think, hey, wait a minute, I'm done. I decide I'm done.
Right.
Not the doctor, I decide, or whatever. Mm-hmm. I think it's not in my house anymore, but it's going into the water system and it's affecting the ecosystem. It's affecting the fish, and then wildlife.
Then the other half of this, and Rich could probably speak to this also, is there are several watershed areas in the state of New Jersey that actually have sewage treatment plants upriver of clean water intakes. So now they're taking in water to treat, to send out to people's homes, and not only do they have to worry about treating it for bacteria and for, you know, the usual suspects, but they also have to now worry about, are there pharmaceuticals being passed through to consumers?
Okay, before I go to Eric, here's what I want to do. I want to make sure people understand. This Dispose My Meds website is important because I want literally go on it right now. Because as we went on it, we went on it right before we walked into the studio. You go on the site and it literally can tell you if your pharmacist is participating in this program, correct, Rich?
Very correct. In fact, all you have to do is plug in your zip code.
Zip code's the key.
And zip code's the key, and it actually comes up with the list of pharmacies that are in your area that you can safely bring back your medications. You know, I want to get back to a little bit what Bill talked about, which is what the effect has been in our nation's waterways. The effect is also we've seen in our drinking water in very, very trace amounts, because we know that science is far ahead in the detection phase than we are right now in the treatment phase.
Translate that.
Well, it means that we can detect things down to levels, trillion parts, you know, per liter. We can treat maybe up to billions and millions of parts, so the detection phase is ahead.
Translate that in English.
In English, it means that they're in such tiny, tiny amounts. And just as Bill said, the treatment systems that we have right now aren't capable yet. And we're testing new treatment methods of taking all of that out. But I can't blame the consumers, because if you think about it, there's no one in this world that wants more than H2, 2 parts of hydrogen, 1 part of oxygen in their water.
That's right.
H2O. We don't want, you know, aspirin. We don't want hormones. We don't want any drugs in our water supply. So the problem is, you know, getting them out, and the problem is keeping them out. And that's really where Dispose My Med comes in, because it's a perfect solution to make sure that they're not getting into the water supply.
And the other part of this, Eric, I want to bring you in, sure. Project Medicine Drop. Yep. This is, talk about, by the way, explain your role governmentally. What is your operation?
So governmentally, I oversee what is called in the state the Division of Consumer Affairs for the state of New Jersey. We oversee the state's drug control unit. We oversee the Board of Pharmacy. We oversee the Board of Medical Examiners, every doctor. We have about 600 employees. And because of our oversight over these agencies, over professionals who prescribe and dispense these drugs, we've taken really a proactive role. And we're concerned about the environment too, but where we're really concerned is those drugs that aren't even flushed down the toilet. What happens to those drugs?
Like what?
Like any controlled dangerous substances, frankly. That's where our real concern comes in, because those drugs, for those people who may not want to hurt the environment or just don't think about it, they sit in the medicine cabinets. And as we all know, if anyone has ever had a tooth extracted, you go in, you have a tooth extracted, they give you a 30 or 90-day prescription of essentially heroin, because it's an opioid.
What?
Well, because any derivative of an opioid, just like heroin, controlled dangerous substance, oxycodone, oxycontin, they're basically the same exact thing. The properties are exactly the same.
1 second, time out. I can't bring that to David.
So that's the issue, right? Because of the Drug Enforcement Agency, because of federal laws, our pharmacists can't accept that product. They can't legally take that product back.
So let's be clear with folks.
Sure.
Dispose My Meds, you go on, you put your zip code in. Oh, wait, I got, whether it's David or whomever my pharmacist is, I can bring in, I can't bring that, I can't bring Oxycontin in.
You can't bring any controlled dangerous substance, prescription painkillers, you know, anything that's on the registered list of controlled substances. So, you know, anything you got for pain.
Now put up the government website now, team. Put up Eric and his team's website, because this is where you guys come in.
Yep.
Jump in.
So the Attorney General really is trying to get proactive in this area, given our oversight over this area. For years, the Drug Enforcement Agency would do these yearly or biannual take-back events where they would get together, law enforcement, local law enforcement, and take back people's controlled substances, their prescription drugs that they're not using, that they don't want from a relative who passed away. Those only happen twice a year. So we saw a real need for people to be able to walk in 24 hours a day, 7 days a week, 365 days a year. Our goal was, we set out about 1.5 years ago, initial goal, get one of these boxes. They essentially look like a mailbox, so they're secured to the floor. You can't break into them. They're sitting right in front of your police station window. Get them in every single county in the state of New Jersey. We did that last year. Now we have doubled it. We have 43 boxes throughout the state, one in every county. You can walk in, no questions asked. You can dispose of your controlled dangerous substances. You can dispose of your estrogen. Whatever you have, you can get rid of, and law enforcement agencies will take it and will dispose of it in an environmentally frankly, with no charge.
No questions asked.
No questions asked. Nobody will stop you. Nobody will ask anything. You just put it in and you walk out.
No charge.
No charge. Not only no charge to you, no charge to the state of New Jersey. We're doing it through partnerships with some major waste incinerators, Covanta, who have been approved by the New Jersey Department of Environmental Protection for the way they dispose of it, and they actually turn the waste into energy. So it's a win-win all around.
I want to be clear. You do. I mean, there's the economic realities here. With Dispose My Meds, there is some charge.
I don't charge my patients for taking back medications in the pharmacy. There is a cost to the pharmacist. The containers are rather expensive. They cost me about $100 a container. But I bear that cost because it's important to me to be doing it. On a practical level, what I see on a daily basis is people coming in with a bag of medications, and the pharmacist has to sort through them and pull out the controlled substances and hand them back to the person bringing them in. Now, in many cases, that's traumatic. I've had conversations with parents who don't want that medication in their house because they have teenage children. Yeah. I have someone whose spouse died. They don't want to see the medication because it reminds them of an unpleasant moment in their life. But we had no mechanism for disposing of those until recently. Yeah. And I'm happy to learn about this initiative, actually.
Yeah. And that's where, I mean, when you say it's traumatic, that's what is really traumatic to us, because the fact of the matter is, it's primarily your younger age or high school age students who are fishing around their grandparents' medicine cabinets, their parents' medicine cabinets, and looking to basically, you know, secure a drug that you used to have to go into a seedy part of the city in order to get. Now they can just go and get a 90-day supply of drugs, and we've heard of pill parties, we've heard of these events where, you know, kids are just sharing medications that weren't prescribed for them and are dangerous. So
it's in so many ways, we're interesting. You're talking about it from an environmental point of view. We're talking about it because it has such a terrible impact on our environment. But on another level, Rich, if we do this the right way and we're proactive and this public awareness campaign is effective, and you can never do enough, and Dispose My Meds, you go to your pharmacist, you're doing it the right way, your initiative with the Division of Consumer Affairs, if we're doing it the right way, and people are being proactive, and we're moving people, and we're just one public television series, but others are involved, it has the potential additional benefit, Rich, that we're just talking about, of helping deny younger people looking for access to drugs, of getting those drugs.
That's exactly right. This is almost a sister program, basically, to the Dispose My Meds program, if you will. And if you will, it can really work in concert together to keep drugs not just out of the hands of kids, but also out of, you know, our water streams, our wastewater streams, so that all drugs are going to find the safe way to get incinerated and to be done with. You know, it used to be that the EPA, the DEA, Fish and Wildlife all espoused a different way of dealing with household drugs, with leftover drugs.
Confusing.
It was
put it in a coffee can. So
exactly.
Put it in a coffee can. Put coffee grinds in it.
Right.
Oh no, that doesn't work. You know,
and some actually told you to go flush it. Flush it down the toilet.
Which, when we first started talking about this, I think it was a little over 2 years ago.
Yep.
I thought flushing them down the toilet was the way to go, and you said no.
Exactly.
And you asked me. I remember you asked me, where do you think it goes? And I remember thinking I didn't want to think about it. And you said, well, think about it. In the waterway.
Exactly.
So the point is, we need to, by the way, Can we say what not to do? Can we get that out of the way? You don't flush it.
Right.
There's no way we can say that flushing it makes any sense. We agree?
Absolutely.
Never.
Can we do the coffee can thing?
No. The coffee can thing basically takes a problem that exists today and puts it into tomorrow. Because if you throw it into you throw it in a landfill. Well, what's going to happen eventually in a landfill? You're postponing the actual destruction of these drugs to a later time frame, when somebody's going to have to deal with it 50 years, 100 years down the line, because they're going to come back.
From a pharmaceutical point of view, from a pharmacological point of view, there have been times, I probably shouldn't say this on the air, my producers are going to get mad. I remember when I had shoulder surgery, I had these painkillers that were helpful afterwards. Terry, our floor manager's looking at me like, what's he going to say? I held on to them, I used them for a little bit, and then the pain went away, and I thought, okay, I'm going to keep these. You know what I'm going to say, right?
Oh, yeah.
In case I need them again, because I get these migraines sometimes.
Are they still
that are
sitting
really
there?
bad.
They're probably still sitting there.
All right. I really should say this, because Rich is my longtime friend. I still have them. I shouldn't do that either, because they were prescribed for my shoulder after the surgery. What am I doing with them in the house, waiting to maybe use them if I have a migraine and need them for the pain? That's bad too, correct?
I have to say yes to that.
It's not smart.
It's not a smart thing to do. There's also issues with expiration dates of medications.
Right. You talk about
whether
that.
they're still going to be effective. When I first started practicing, there were no expiration dates on medications.
Why are there expiration dates on medications?
Well, a manufacturer has to test a medication and prove that it's still effective over a certain period of time. It's an expensive process, so a lot of manufacturers won't give an extended expiration date on medications, but in fact, many of them may be potent for longer periods of time than we know. But also, the prescriptions are prescribed for a condition, and they're supposed to be used for that circumstance, and then they're supposed to be disposed of in a proper way. That's the way the system is supposed to work.
We should not be deciding for ourselves, hey, let me keep this around in case of whatever. That's not our place. Bill, Captain, I'm going to bring you back in here.
Well, one of the things, I'm listening to the other panelists talk about their programs, and I'm very impressed that both the pharmacy industry is addressing the issue, and from law enforcement, we're addressing the issue. But we need to do a better job of getting that message into the community. And hopefully the show will be a step in that direction.
And by the way, we've been running a public service announcement, right, Rich, for, I guess, almost 2 years now.
Yeah.
Which has been done in cooperation with, say the organization again, because it's a community of pharmacists nationally, right?
NCPA, National Community Pharmacists Association. We're responsible for about 40% of the medications.
There's actually a public service announcement that we were running for a long time that actually told people what to do and what not to do with the drugs. Keep going. Keep talking, Captain.
Well, it's a very confusing program when because a lot of the people that are prescribed these medications that, or let's say inherit these medications from a relative who may have passed or whatever, they're not educated to what constitutes a CDS and what isn't a CDS. Anything that comes with a prescription to them is prescription medicine.
Right.
And so that's the part that I think we really need to start informing the public more.
Right.
Like putting up a list of and name
the
names,
do's and don'ts.
name the brands.
What do you mean name the brands?
Well, there's oftentimes when you start doing public relations and the legal people take a look at what you're doing, they say there's you may have a liability if you name a certain trademark. Like you were talking about OxyContin before, Now the people that manufacture OxyContin may take objection to the fact.
Well, no, I think what's been, no, it's not a question of name brand. Here's how I interpret it. Yeah. That the law says that there are certain narcotics that you cannot bring into your pharmacist under the Dispose My Meds initiative to say, here, take these. You cannot take them back. That's what the law says.
Correct.
And what you are saying is, go back to the other website, team. Flip it to the other website if you could. That website Your website at the Division of Consumer Affairs will do what? Repeat it again if someone just happened to pick up the show right now.
It will give you the locations of, at this point, 43 locations around the state of New Jersey where you can walk in and dispose those meds. And just
into a what? A drop?
It's basically, it looks like a mailbox, but it's basically a safe.
What does it say on it?
It says in huge letters, and you'll see a picture of it on our website, has huge labeling, Project Medicine Drop.
It says Project Medicine Drop.
The Attorney General's seal will be on there, and it has our logo for this program.
There's no cop waiting around the corner for you, right?
They don't care. They don't care, honestly, because what they want, first of all, most of the folks who are going to walk in are your citizens who, like you, got this prescribed for the shoulder surgery. They don't want it sitting in their house because they have teenage kids, because there's contractors coming in and out of their house. We've heard every story of theft and diversion you would ever imagine. And so what we're just trying to tell people is, you may not even realize that somebody wants that stuff. Get it out of your house, get it away, and you'll help us from a law enforcement perspective.
Okay. What would it take to get one of those drop boxes into, you said you had 43, so that leaves about roughly 520 municipalities that are not served.
Yeah.
Right? We have 566 municipalities.
A lot of places.
Yeah. You know?
Yeah.
What would it take to get them into every municipality?
Well, the answer would be money. But
well,
the answer is money. But that's our goal is, look, even if we can't get one in every municipality, it's about accessibility, right? I live in Bergen County. Every town's a mile long, basically.
Right. I mean, 70 towns.
It's not right. It's not that hard. If it's 4 or 5 towns over, I can drive 2 miles. But we are trying to be strategically locate these so they are accessible.
Let's do this in the 5 minutes we have left. Let's talk public awareness and education, Rich. This program, the public service announcement we've been running for a while, fine. But let's be candid. This is an ongoing, sustained campaign that has a long way to go because it's taken us a long time to get to this point to be dumping a lot of this stuff into the toilet, out into the waterways. What else do we need to do?
We are actually working with some of the big box retailers as well. The National Community Pharmacists Association has about 26,000 community pharmacists across the nation. Great people that really are doing a great job in fulfilling all the public needs. But we also know the big boxers like CVS, Stop and Shop, Walgreens. We want to get them on board too. Some of them have a program, but they make you pay for it. And what we're trying to do is to get them to see the wisdom of enabling consumers to come in there and be able to dispose of it for free. So we're working with them. We're also working with the pharmaceutical companies as well. As you know, New Jersey's a hotbed. You know, Johnson & Johnson, Sanofi Aventis. There's a lot of big, drug manufacturers that are right here in the state of New Jersey, and we'd like to be able to get them on board this program. We'd like them to maybe do what the consumer electronics industry did. The consumer electronics industry formed its own 501c3, a charitable organization, to basically take old computers, TVs, recycle them, all right? So what we'd like the pharmaceutical companies do is maybe do that same thing. Maybe form a 501c3 that helps people take care of their drugs when they're done.
Sorry for interrupting. See, you got the Dispose My Meds initiative right now. One of my concerns is having lots of different organizations. It's great. You talked about the pharmaceutical industry. We talked about, I happen to go to CVS because it's, around the corner, and it's the one we've been going to for a while, the pharmacy there. One of my concerns is everyone having their own thing. Could that be confusing, or is the goal to get everyone to be a part of that, Dispose My Meds?
I'd like that to be the ultimate goal, if everybody got it.
It's not like somebody's making money off that. It's a nonprofit.
In fact, it's costing money, and it's good people
I just want to be clear.
Actually. So maybe we could get the pharmaceutical companies to help fund the program. Even that would be, a better way, a better alternative.
Absolutely. Right. But we need them to participate.
No doubt.
Or we're not going to get out there to as many people as we need to in the way we need to. God, I'm sorry, jump back in, David.
Also, since our goal here is to get as many of these medications out of the community, out of the environment as we possibly can, I think we need the most efficient way of doing it. And a lot of that is consumer education, as you said. You have the resource of the pharmacists in the community. These are the people who can determine which is a controlled substance, which is not a controlled substance. We have regulations allowing the return of medications, but not the return of the CDS. If we could write those regulations in, possibly, your program is amazing. Okay, I think we're probably the only state that has that right now. If we could find a way to write regulations so your program could exist, but people could also bring everything back to the pharmacy, I think we're going to capture a lot more of these medications.
And to your point, I love our pharmacists, and you know who you are. I'm not going to say your names. You're terrific. You're great. But you also know you've never initiated a conversation with us about this. Meaning, and isn't it in part the responsibility of the pharmacist to be engaging consumers and saying, listen, I want to talk to particularly long-time customers, you know, what are you doing with your unused? Am I wrong about that?
We advertise the program. I absolutely firmly believe in that.
Okay, so we have responsibility as consumers, but pharmacists have responsibility as well, right?
Yeah, I mean, look,
a few seconds left. Keep going.
They have responsibility. The doctors have responsibility.
Doctors too?
Overprescribing is
Like, don't give me too many.
There's not more pain than there was 10 years ago, yet there's, you know, tenfold as much of prescription as prescription drugs. And so it's people, don't give them too many. People they'll come back for more. There has to be control. We have a new program. It's our monitoring program. Every pharmacy in the state has to log every time they dispense prescription drugs. Doctors should be using it to monitor their patients.
Listen, everyone needs to take responsibility here. I know it won't be the last discussion. Last time we talked about this important topic. Thank you all very much.
Thank you, Steve.
The preceding program has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus, New Jersey has been provided by United Water, New Jersey Natural Gas, Barnabas Health, New Jersey Manufacturers Insurance Group, Wells Fargo, and by the law firm of Gibbons PC. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.
Each year, Americans fill 4 billion prescriptions, but as much as 1/3 of that medication will never be used. Some of this waste ends up in the rivers, lakes, and streams that make up our drinking water supply. The United Water Foundation and the National Community Pharmacist Association have partnered to bring you a simple solution. Dispose your meds responsibly. Go to disposemymeds.org to find a participating pharmacy and to learn more. A public service message from the United Water Foundation and NCPA.